Hey everyone, Dr. Shawn here. Today I want to talk about self-myofascial release. Basically what that means is you're causing a release in a tightened muscle or tightened fascia due to various things. Could be an injury, could be improper movement, whatever it may be. And the self part is basically because you're using a tool that you can use yourself. You don't need a healthcare practitioner. And the two most common tools would be a foam roller or a massage ball. So my favorite is the massage ball, and I'll be demonstrating how to use this little guy in just a moment. This is probably one of my favorite tools to have for self-care at home in terms of muscle pain and pain management in general. They're relatively cheap. This one was under $20. I purchased this through my clinic, but I've seen various types of massage balls on sale at sporting goods stores. Like here in Canada, we have Mountain Equipment Co-op. I've seen many different varieties of this. Basically, it's a dense rubber ball with some little spikes on it, and what these spikes do is they get into the trigger points. And what you're going to be doing is finding your own trigger points. You stay on the trigger point for about 20-30 seconds, and you'll slowly feel a release of the muscle. And this really improves range of motion and muscle recovery. So I actually have an injury. Those of you who follow me know I'm a climber. And about 6 months ago, maybe a little bit over that, I separated my left shoulder, which is an unfortunate injury that really can't be prepared. All you can do is manage it and strengthen the muscles of the shoulder girdle and the rotator cuff, but I am prone to injury. So every month or two I will re-injure the shoulder and get some soreness, pain, and inflammation in the shoulder from my arm kind of slipping out of the socket. And that actually happened to me just under a week ago. So I'll show you how to use this, and it really helps. Like, it's quite amazing. When I injured my shoulder maybe about 3-4 days ago, I couldn't really lift this side up past about the 90-degree point. It was just too painful. So I went home, I used the massage ball, and immediately after I got almost full range of motion. So I'll show you how to use this. I'm going to be applying it in the back of my shoulder. That's really where my problem is. My problem is the rotator cuff. So there's a few muscles there that kind of wrap around this area. There's teres major, teres minor, subscap, suprascap, and those will be sort of the ones that I'm targeting. So it's super easy. You figure out where your pain is happening, so what region of the body is it, shoulder, back, glutes, what pecs even, whatever it may be. And you want to apply some pressure to that point. So you can do this up against the wall like this, or you can do it lying down on the ground or on some sort of table like I've got here. So I'm going to put this down over here, and I'm going to put my weight on the ball. And for rotator cuff, you want to be kind of just right above the armpit area. And so we're just working to find that spot. And once you hit that spot, ooh, that's it. You'll know it. It'll be painful, and you'll know when it's the right spot when it reproduces the pain that you've been feeling. So whether it was an injury or just some muscle stiffness, it'll reproduce that pain. So I'm just kind of right on it right now. And once you get right on it, and the pain is bearable, just get right there. Sometimes you'll have to put your arm or whatever into a bit of a position that you can get to the muscle. So if I got my arm right here, I could get right in there, right under the scapula. It's kind of a weird area. So I'm right on it now. So what you want to do once you hit the area, just keep the pressure on that area for about 20 to 30 seconds. And really what you're waiting for is a release of the muscles around. So you'll feel kind of rigid and tight at first around that area, and then as the muscles start to release, you'll feel you could kind of relax into it. So right now I actually just felt a muscle twitch, which is a good sign. That's basically the muscle kind of resetting itself and relaxing. So there we are. So I could actually feel this as a trigger point. I could feel the pain kind of radiating up into my shoulder area, which is a great sign. If you can hit the trigger point, meaning that the pain is not just local to where the ball is, but it's actually shooting somewhere, or you feel the pain somewhere else, that's a true trigger point, and that means you really got the spot. So right now I could feel that pain's gone away. I could feel some of the muscles around the area relaxing. And then you can just kind of move on to the next spot. So there's another spot right here, right along the scapula, and I could almost feel that go down my arm into my hand, so you know that it's a good trigger point. And I'll just keep it there for a few seconds, and then you'll start to, remember to breathe. Don't hold your breath, and you'll feel it relax around the massage ball. Okay, so that's it. When you get up, oh yeah. So I didn't show you guys, but before, I had pretty good range of motion, but it was still kind of stiff. Now it feels really smooth. So there you have it, self-myofascial release using the massage ball. You could also use a foam roller. Such an excellent tool to have at home. It's basically priceless in my view, but they're cheap anyway. If you like the video, please comment. If you have any questions, post them in the comments area, and I'll get back to you soon with another video.